Hi, Terri Coutee with Deep Sea Foundation. I am with Dr. Minas Chrysopoulo and Dr. Ramon Garza from PRMA in San Antonio, Texas. Welcome, gentlemen.
Hello.
After I had my DIEP flap breast reconstruction, and I suppose this would hold true for implant-based, but I want to address that also, I was given an order to have physical therapy right after I traveled. So right after I got home, which was about a 2-week period after my reconstruction, to begin ultrasound guided physical therapy. And I have a lot of women ask about the benefits of it. So in terms of minimizing fat necrosis, which has also been a topic that has been brought up, can you talk to us about the benefits of physical therapy in terms of minimizing the fat necrosis?
I think physical therapy is underutilized for breast reconstruction patients or breast cancer patients in general. So,
yeah,
breast surgery, axillary surgery, lymph node surgery, whether you have reconstruction or not, it can really have an impact in terms of shoulder movement. You can lose a range of motion. Any surgery can create swelling. In terms of the breast reconstruction as well, breast reconstruction is more extensive surgery than, say, a lumpectomy. So you've got even more reason to potentially benefit from some physical therapy. There are several physical therapy techniques that are utilized. Generally speaking, after any surgery, deep tissue massage can be very helpful to break up scar tissue. And there are other techniques that can help release tissues and help encourage the correct movement of certain tissues within certain planes. Like myofascial release is another one. And ultrasound helps by decreasing fluid accumulation, encouraging drainage. There's some concern from some physical therapists to use ultrasound in a cancer patient because there is a fear that you're encouraging new blood vessel formation, and are we going to encourage a recurrence? There's no data to suggest that whatsoever.
Okay.
So I'm not someone who buys into that thinking personally, but that may be. It may be that some patients get some resistance from their physical therapist to use ultrasound if they're a cancer patient or a prior cancer patient. So that's just an FYI.
Yeah, that's good to know.
So, and with fat necrosis specifically, there's some firmness of the breast that's very common after any breast surgery. You could have a breast reduction. So no cancer, you just have large breasts, you need them reduced, you're having back pain, neck pain. So, and you can have fat necrosis from a breast reduction. So any breast surgery can give you fat necrosis, whether you're a cancer patient or not. For a tissue reconstruction, the tissue that we move in there can also develop fat necrosis, and the rates vary depending on the studies that you read, but for a DIEP flap, for example, you're looking at 10 to 14%. Some of the firmness that you may feel early on after surgery will settle on its own and go away on its own. Some of the prolonged swelling you may have will settle and go away on its own. The problem I have with waiting is that if you wait too long, you've potentially missed an opportunity to help soften things up. So I'm very quick to refer people to physical therapy for range of motion exercises, for deep tissue massage, and also for ultrasound. And I've had great success with patients doing that. I don't have the issues with fat necrosis that we used to have. Our fat necrosis rates have come way down, but there are several reasons for that. We're doing things differently in terms of perforator selection and other things in terms of the actual surgery too, so you can't give ultrasound all the credit, but I think it certainly helps soften things and give people a nicer result in terms of decreasing the firmness in their flap reconstruction that they may have, and improving the swelling quicker, and then definitely with range of motion. So,
yeah. Well, I had it after my mastectomy, and then I had delayed DIEP, so I had it after my DIEP flap too. So Dr. Garza, do you ever, I know the physical therapy is a good, script to give women, but do you ever have them do a self-massage too, in addition to that, to diminish the fat necrosis?
Absolutely. I think that's important, particularly with the swelling that happens after, like Dr. Chrysopoulo said, after any surgery. It's something that should be patient, physician directed. Every patient is different.
Sure.
So you have to wait until the patient's in a good, appropriate amount of time after the initial surgery to begin those types of things. Something as simple as doing scar massage to help decrease the swelling in the scar, help break up some of the scar tissue that is forming is important. Typically that happens about 3 to 4 weeks after the initial surgery. So you have the scar that's in the maturation process at that time. The scar takes a full year to completely mature, and during that first 6 weeks to 3 months, the scar actually becomes its most thick, its most raised, and its most inflamed. So if you can help mitigate that with some massage, again, that should be directed by your physician, it can decrease some of the swelling in the flap and decrease some of the scar formation around the flap.
So a question, because, I've gone to just my PC before if I have some physical, anomaly or something, and they'll have a handout. Well, here, do these exercises. So if someone comes to you and says, well, should I be massaging my breast? It would be after phase 1, correct? So should I be massaging my breast? Do you guys do handouts, or was that something that maybe they should ask their physical therapist about, or do you know?
Yeah, it's something I think that should be discussed with either physical therapist or surgeon. We don't have specific handouts for breast massage. Again, it's patient specific. There's different situations where I don't want a patient doing a lot of massage for whatever X reason.
Right.
But there are patients who I see like, okay, this patient is going to benefit from this, so I'm going to tell them, hey, in this area you feel some firmness, that's swelling in the flap, and I want you to start doing some massage and some of the exercises that we talked about.
So I think what I'm hearing from both of you then, it's a good question to bring up. As you said, it may be specific to the particular flap that's put in or the implant that's put in, the particular details of the patient's surgery, but it's worth asking the question, should I be doing massage to diminish the fat necrosis?
Well, and also, what does that mean? What's massage?
Yes.
For some people, it's just rubbing. Oh, I'm massaging my hand right now. No, you're not really. You're just rubbing the skin. That doesn't do anything. So, I think instruction and demonstration is really important. So, first and foremost, discussion with your surgical team.
Yeah.
Getting clearance from them, and then having a therapist who's familiar with breast recon to show you, to evaluate you, make recommendations, and oftentimes, the best scenario is that there are easy exercises that the patient learns and can do on their own, because, to be honest, the more you do, the better, and so you don't want to be depending just on the therapy session you have when you go to the therapist. So you've got to be bought in. But I think demonstration is key.
Yes, because I know my physical therapist showed me, and I would do them, like in the evening sometimes, and also the nurse. I asked her before I left too to kind of show me how deep to do the massage and which areas. So all good information. Thank you guys so much.
You're welcome.
All right.